Good morning, everybody. Can I firstly thank the more than 23,000 people that presented themselves for testing to 8 p.m. last night. That is a very good result, and we need that to continue and increase today. As we disclosed as soon as we found out yesterday evening, the limousine driver tested positive yesterday, as did his wife, the household contact. But we can further update you this morning to say that a woman of 70 years of age who also was at the Bell Cafe on New South Head Road in Vaucluse has also tested positive. So it's really, really important for everybody in the eastern suburbs or everybody who may have attended any of those venues to follow the health advice. If it is deemed to be a close contact of any of those venues, you need to get tested and stay home and isolate 14 days, no questions asked. In addition to that additional case this morning, we also have a gentleman in his 40s who has tested positive in the Balcombe Hills area. However, health is still determining whether it's a false positive or an old case, as the viral load in his system was very low. So on that basis, it could be a false positive, or else it could be an old case, and as yet unrelated to the eastern suburbs cluster. But having said that, health will provide confirmation of those details. In relation to health advice of people in eastern Sydney and greater Sydney, we're asking everybody to be extra careful. If you're in the eastern suburbs, unless you absolutely have to attend a large gathering, unless you absolutely have to engage in activities of a social nature in the next few days, we ask everybody to refrain from that, to be extra careful, to make sure you hand sanitise, you socially distance. If you're catching public transport, we recommend people wear a mask. So at this stage, we're all on high alert, but we're asking people to modify their activity, to consider where they've been, what their movements have been and what the movements may be until the next few days, we go through the next few days as the situation is evolving. This morning, Minister Hazzard, Deputy Commissioner Warboys and Dr Chan obviously will give updates in their respective responsibility areas. I can say at the outset that police are investigating as to whether the limousine driver complied with existing health orders, and that's the police investigation that will determine to what extent that driver complied with existing health orders, which is very important. We know in New South Wales, no matter how good any system is, no system is perfect and no system is foolproof against the pandemic. Yesterday I received updated information to say that in relation to people coming through Sydney Airport, we now have nearly 60% of those people not from New South Wales. Because Victoria's been out of action, other states aren't doing their fair share. New South Wales is welcoming home 60% of people who are from other states. The exact figure is 58%. So we are carrying a large burden, and every system carries risk in a pandemic. We accept that. But what will be measured by is our response to it, and to make sure that we continue to have public safety first, but also keep the economy open and our jobs going. So at this stage, all we're asking people to do is to be on extra high alert, especially if you're in and around the eastern suburbs. The eastern suburbs community has been through this before and responded really positively. We're asking them to do that again. Please make sure you get tested if you've been to any of those venues, or if you have any symptoms whatsoever. Please follow the health advice strictly. Some of those venues that have they've been listed on the health advice or listed on the health website have been deemed to be close contact. So if you've been at any of those venues at a particular time, you should be at home isolating as we speak. You shouldn't be outdoors, you shouldn't be engaging with everybody. Pleasingly, as Dr Chant will say, the driver's close family contacts who he had some contact with, I think there were 4 of them, have proved to be negative, and some of his work colleagues who have been tested are also negative. But that's not to say we can be complacent, quite the contrary. Given the crossover point of the 70-year-old woman at the Bell Cafe on New South Head Road, it demonstrates that the virus is contagious, that all of us have to be on alert, but we're asking everybody to take those precautions you've taken before. Socially distance, make sure you hand sanitise, make sure you don't engage in any activity with large gatherings unless you absolutely have to, and just be extra cautious. Assume that everybody you're in contact with has the virus, and assume you have the virus yourself, and that is the best advice we can give you as the next few days unfold. I now ask Dr. Chant to give our health update. Minister Hazzard will then make some comments. Deputy Commissioner Warboys will make some comments, and then we'll take any of your questions.
Thank you very much, Premier. So in terms of the 4 cases I wanted to discuss today, I'll take you back to the diagnosed case we announced yesterday, and we issued 3 public health alerts with venues, so I urge people to check that website for those updated venues. So we had a gentleman in his 60s who is a driver, who drives a limousine, and he is, as part of his work, is involved in the transport of international flight crew. He tested positive on salivary testing, and then that was reconfirmed on the oral pharyngeal swab and tested positive yesterday. His household contact, his wife, has tested positive yesterday, and that was what also led to some additional venues being identified. Last night, pathology confirmed that this gentleman has the Delta strain of the virus, and that this strain does not match anything that's been uploaded in Australia at this time, but it does match perfectly a sequence that's been uploaded from the US. And so that fits with that plausible hypothesis. Whilst we do test flight crew on the way in, there's always a chance, as I indicated to you, that that's why one test at one point in time does not confirm your infectiousness, and you may develop infection at any point during your period before you're departing Australia. So that's our working hypothesis. Whilst infectious, the couple attended a number of venues in Vaucluse, Bondi Junction, Zetland, Redfern and North Sydney, including the 200 bus from Bondi Junction to Northern Sydney and return on June 15th. We've tested 4 family close contacts who are from a different household, who spent time in the infectious period with that couple, and 2 workplace close contacts have also tested negative, but they'll be in quarantine for the full 14 days as their close contacts. In terms of the new cases that we haven't identified, last night we had a person who was diagnosed, who tested yesterday morning, so before this news broke out. So again, it highlights my gratitude. I want to extend my gratitude to the residents of New South Wales for coming out for testing. That person had attended the Bell Cafe at Vaucluse at the same time as the driver on June 13. We consider all people who were at that Bell Cafe at the same time as the driver to be close contacts, and they must all be tested and isolate for 14 days after their visit. Now, because we have had transmission at that cafe, we are urging everyone to take the request for testing seriously. Please present now. That will help us identify any unrecognised cases and stop any further chains of transmission. In terms of the additional gentlemen, we've had a gentleman in his 40s from Sydney's northwestern suburbs who is not, on preliminary interviews, not linked to any of the sites or venues. The gentleman had high CT values, and for us that means a low viral load. We do the usual things. So when you get that, you're uncertain about the timing of infection. So what we do is we repeat the testing the next day. Sometimes it can be early in an infection when you get that high CT value, low viral load. High CT values can indicate that you might be beginning to be infectious, or it could be an old infection or in false positive. So we're testing all of his household, doing other respiratory testing on the household, and also reconfirming that testing. And if there is any virus to be sequenced, we will obviously sequence it urgently to see that it's linked to this cluster. It's always important that we keep a very open mind in these investigations at this time. So for me, the message is we've identified a number of venues. When you were contacted, and can I thank the community last night for the response. We had about 450 people ring the call line last night to self-declare that they were a contact venue. So thank you very much for the community response. We know that there's been a strong response to testing, and those test results will actually allow us to assess the extent of the risk posed by this incursion event. As the Premier said, this is a time for us to be vigilant, so pay particular attention. Please follow the health advice, but check regularly that website, because as we interview cases, People do remember new things. As you know, we often interview cases several times, and those lists will change. We also go through a process where we've issued a stop and stay, and what that means is we're asking people for a number of venues just to get tested, isolate, and then public health will evaluate the situation, and sometimes that information changes. If we find that transmission has occurred in an event, that might allow us to increase the scope or upgrade our response. So again, please, every day, would I urge everyone to check the New South Wales Health website for those venues of concern. Thank you.
I think it's fair to remind all of us that 3.8 million people have died as a result of this COVID-19 virus across the world. The virus right now is more dangerous than it has ever been across the world. We have airports, we have people coming in from across the world, and therefore we can assume the danger will come to us at some point. There is no room for complacency. Being slack about what the health authorities ask you to do is just inexcusable. We have to make sure that we all follow the rules. Now, the police are obviously investigating the particular circumstances surrounding the limousine driver, and I won't be commenting specifically on that limousine driver or those investigations. But what I will remind all drivers who pick people up from the airport more broadly is that you have obligations, and your obligations are legal, and they are to get saliva tested every day and to make sure you wear appropriate PPE. If you don't do that, you're breaching the orders, and the police will investigate you, and of course there are possible consequences of that. But the worst consequences are, of course, that the virus can enter via what might otherwise be a complete non-compliance, in fact just plain slackness about complying with what the health authorities have asked you to do. We all need to take this seriously. Can I strongly suggest to the folks in the eastern suburbs, definitely, if you're getting on a bus at the moment, wear your mask. It's sensible, it's safe for you, but it also stops hopefully any transmission to anybody else that might be in the bus. But it's one measure we can take to keep ourselves safe. Also, take seriously the venues of concern that health has identified. We've already heard that one 70-year-old lady happened to be there at the wrong time, in the wrong place, and got the virus. That could happen to any one of us. Take it seriously. We will manage this. We will manage it again, and we'll manage it again and again and again, because I'm sure this will occur at times in the future while we're in the middle of a 1 in 100 year pandemic. But it also should be a salutary reminder to all of us that you should get vaccinated. Get vaccinated. You can't hide from what's happening through the world when we've got airports and people coming here. Go and get vaccinated. As soon as your turn comes, go and get vaccinated. Thank you.
Thank you, Minister. Dr. Chan. Premier, we need to be really clear that right from the outset that the police hotel quarantine system, Commissioner Fuller has made it clear that it doesn't come without risk. Today we have 188,000 people have completed that hotel quarantine process since we started. As we hear today, over 5,000 people are in hotel quarantine being looked after by New South Wales Police, Security, ADF and our friends at Health. If we look at since December, when the order was changed around flight crew, 37,000 people who have piloted planes or been in flight crew have been put into hotel quarantine. There is a risk that comes with that. We accept that risk. Our Police Operations Centre is open and has been open every minute of every day since we started the hotel quarantine process. The Premier and the Minister have spoken about the limousine driver, and we'll continue that investigation until we finish with an outcome that we can actually draw some conclusions and take some action if we have to. But we won't wait for that. Already the Police Operations Centre has started to have a look at the systems and processes around drivers who take flight crew and pilots from the airport to hotel quarantine. What we know is that the process that we have in place, 188,000 people through that process, with minimal disruption in terms of incursions or disease, that process is robust, it is dynamic. The police, every single day, have a look at the systems and processes that we use. We talk to health every single day, take heed of the best health advice, and where we can, we will improve those processes. I'm very confident that as we move through the investigation in this particular incident, that we will ratchet up those areas where we think we can better protect not just people inside that system, but the people who work in that system and the people of New South Wales. So the hotel quarantine system is not just about the people inside the hotels, but it's about the workers, the people that cook the food, the security people, the drivers, the ADF, the police, the health. There are so many moving parts in this hotel quarantine system that every single day the Police Operations Centre work with health to make sure that it remains the best quarantine system in the country. So I can give people confidence here today that based on the information that we've had over the last couple of days, that we will not sit idle. We will investigate, we will come to some outcomes, but in the meantime we'll also look at every single process within that hotel quarantine system at the Police Operations Centre with our friends at Health and make sure we retain a gold standard quarantine system.
Premier, if he's a frontline worker, why wasn't he vaccinated? Like all frontline workers?
Well, this is the issue. We are waiting on the police to complete their investigations. All workers, all drivers within the quarantine system have very strict obligations which are covered in our health orders. And if there's been any breach of that compliance, the police will advise us of that. But we also have to appreciate that no system is perfect, and at many times during the pandemic we've refined, we've updated, we've looked at issues which we hadn't even considered before, and that's what you need to do, because as the virus evolves, as the pandemic evolves, so do we need to evolve. So we'll await for the police investigations as to the degree of compliance, because every worker within our system is clear and should be clear on their obligations. They have certain obligations, and police will provide that information to us as to what...
So it's his responsibility?
Well, the health orders make that very clear. In terms of the daily testing, in terms of what we require from people within the system in relation to vaccinations, and if there has been any breach, that will be reported.
But doesn't the system ask, are you being vaccinated? You're driving these people.
Well,
doesn't someone say, have you been vaccinated?
Well,
it
was actually, from my understanding from initial reports, it was actually precisely for that reason that the person was forced to come forward and get tested. So the system actually identified that, forced the testing, and fortunately we got to the virus when we did. But I want to make sure, what is really important for us in the pandemic, and I cringe when I hear people talking about things which aren't fact-based. We want to get the information before we convey anything further to the community. If this person wasn't complying, again, I don't want to cast aspersions into police.
Was he wearing masks?
Well, we understand that that is also an issue police are looking at.
Do you know how many people that are frontline workers haven't been vaccinated yet?
Well, in our direct quarantine system, people who are employed directly by police or New South Wales Health have all been vaccinated, but we also have to appreciate there are new people coming in every day to the system. We have literally tens of thousands of people involved in our hotel quarantine system. So we've vaccinated all those who are permanent employees, who've been in the system a while, but every day there are new people, subcontractors of subcontractors coming into the system. We need to make sure they're all covered. But let me be clear, the health orders make very clear what the obligations are, and if there's a breach in compliance, we will deal with that. But can I also make this point, which is really important? Our system relies on 100% of people in and around the system doing the right thing 100% of the time. Now, I'd love to be able to say as the Premier that that's happening every second of the day. Most people try their hardest and are under very difficult circumstances. I don't know if any of us in this room would put up our hand and say, I'll deal with someone who's got COVID.
You say new people coming into the system though, surely it's a requirement that they are vaccinated
Oh,
before
it
they
is.
get the job.
Well, certainly, there's no, at this stage, we have very strong recommendations. Anyone who's not vaccinated doesn't work directly in and around the quarantine system, but there is no, that is, because at this stage we don't have, through the National Cabinet process, we don't have the green light to mandate that. But in New South Wales, we've had no issue, can I just be clear, we've had no issue in relation to all quarantine workers in and around the system directly. There hasn't been any instances where people have refused to be vaccinated. However, what we need to do is to make sure, before we jump to any conclusions, let's let police finish their investigations. There are very strict guidelines that all drivers, limousine drivers or otherwise, subcontractors or otherwise, have to follow in the system. Now, if this person didn't do that, we will find that out, but it's not fair for any of us to comment or cast judgment until police finish their investigations. And can I also stress that we are never afraid in New South Wales to cover, if there's any stretch of the imagination, any loophole whatsoever, we're not afraid to deal with that because we've done it before. But there are very strict guidelines on what workers, including limousine drivers, are obligated every single day. And if people don't do that, what's required of them, it can have very tragic consequences.
When was the last time he was tested? Before this most recent test? When was his last?
I don't know if anyone has that information, Dr. Chan.
So perhaps I can just answer indirectly also, just to say that the process is that people associated with the quarantine and border measures are required to have salivary testing, and then we use that salivary testing as almost the denominator for then who gets into vaccination. So anyone who presents for their daily salivary testing when they're at work, and we do give guidance that if anyone develops symptoms at any time, that requires them to immediately get tested in a traditional way. We wouldn't use salivary testing in that concept. And if people are on a break for a period of time, we also advise that they would get and attend a nasopharyngeal swab. Say, for instance, if they had 2 weeks off, that they would also have a test whilst they're on that break. And so once, if we can just go back to the process. So once someone's triggered with a salivary testing program, and then they attend their salivary testing, then what happens is an alert gets sent if they haven't been vaccinated, and we reach out to that individual and make sure that concerns have been discussed, if they've got medical contraindications. We work through all of those issues. As the Premier had said, the vast majority of people, when presented with access to the vaccine, have taken it up. And that's been quite successful, but the program and even the breadth of people that interface with the international airport is quite a broad group, and it will change over time. Obviously, we're looking at the circumstances. This gentleman attended for salivary testing, as I indicated. I think it was on the 15th of June that test was done, and then yesterday we confirmed, when that test result came back late in the evening, that it was a positive test. That gentleman had recently engaged in the salivary testing program and hadn't been prior to that. We will have to, the police will be a matter for police to ascertain what his role prior to that and when he commenced his operations.
So
Is
he's
there
never
a
done
first
any
time?
testing? That's
First time.
So the first time he had successfully completed salivary testing was on the 15th of June, and as I said, those are a matter for
So you have no idea how long he's been driving with it?
We're obviously following up everyone that he has been, that his work colleagues and anyone else at the business, to make sure, and I believe police are also following up all of the people to just highlight that there is no non-compliance.
Is there-
Do you know what day he picked up these 3 crew? I believe they're from a FedEx aircraft, a cargo.
Right.
I think it's fair
Do you know
to,
when it picked them up?
I think it's fair to say that there are 2 parts to this. One is health need to glean as much information from the gentleman and other close contacts as they can, and that is the most important thing at the beginning of this process. The secondary part is that the Police Operations Centre are collecting a whole range of sets of data and information, and at some point in time, not too far into the distant future, we will then get the opportunity to speak to the gentleman and others, and then make those inquiries that will satisfy us whether he's breached the public health order or not. But what is really important now is that police allow health good access, a good rapport with that person, to make sure that we gather all the information where that person, that family, the close contacts have been, That's the most important thing at the minute.
So
You know
the
when
FedEx,
you
so
got
the
the
FedEx
crew-
crew, do we know anything about this flight crew, where they are, whether they've been in quarantine, have we tracked them down?
So, just to be clear, we test all flight crew when they arrive and they get a proper nasopharyngeal swab. They come in and they get taken to a flight crew hotel, quarantined, if they're not resident and not being permitted to isolate at home. They then are transported back to the flight, to the airport when their flights. They obviously have a requirement to sleep a certain time and rest, and then they usually depart. So the turnaround time for most flight crew, international flight crew, is very quick. It's usually, it can be 24, 48 hours, whatever meets the aviation airline requirements, and then they usually depart. What we do know is that obviously we need to treat them as infectious all the time. I've repeatedly said to you, this is why a single point of time testing does never tell you that someone's infectious. You have to treat everyone who's come from overseas as potentially infectious. So the hypothesis is that the flight crew would have been long departed. We're obviously going back over the trip. The focus yesterday was very much on locking down and identifying the close contact venues and our priority to stop infectious. Concurrently, we've then been working with the company to find out the specific details of all the trips the person has undertaken in the 14 days prior to onset of symptoms. And then we'll obviously make inquiries of those, of that company to see if they have any flight crew. Not all people get sequenced in the US, given the numbers. And as I said, the match sort of fits geographically that might be the strain. And as I've indicated, just because you have the one strain doesn't mean that person transmitted it. It means that that's the strain that we've found in this case. So we'll be going back those 14 days prior to his onset of symptoms to look at who he transported and do the appropriate follows up internationally to see if any of them have subsequently become positive. But I can confirm that none of those have tested positive on the way in to date. Obviously, I'll just need to again check that someone didn't have a very high CT and has been non-sequenceable. So that work is being done now.
So it could have been at least 2 weeks ago when this gentleman crossed paths with these three.
But he's not infectious, so that's the key point. We're taking his infectious period back to the 11th.
That's what
right?
I'm getting at.
So the 11th of June is when he got symptoms of onset on the 13th of June, so we go back that 48 hours. So it's the 11th of June, we take him as infectious. All I'm saying is the time period from which he could have been exposed, if you take that. Now, obviously, we know the average is 5 days, but you can see the full spread of disease presenting any time between those
What
days.
I'm trying to get at, do you know when he crossed paths with this flight crew?
What we know is
Roughly 2 weeks before the 11th, is it?
we would believe that it was likely to be sometime before the sometime anywhere in that 14 days, but on average, probably more around 5 days max. 5 days is the average. It could have been 2 days before, but that's not significant for the infection risk. So the infection period for him is the 11th.
Is he only dealing with cargo crew? Is he dealing with?
Look, these are as I said, this is a case that's arisen yesterday. Our focus in public health at the moment is certainly making sure that we've got those testing and contacted everyone in those close contact venues. Get people close to him tested as soon as possible, because obviously people that have spent the most time give us the best assessment about whether he's transmitted. It is concerning that this gentleman has transmitted in a cafe, and obviously we'll look at any information about the proximity they may have had, but clearly that gives us a raised level of concern that we've got that transmission, and obviously we want to understand the circumstances of this 45-year-old. So at the moment, we just need to put the community on alert, and the community knows well the sort of test steps they need to take. They need to be up their vigilance, get tested at the earliest possible time with any symptoms, check that website because the information will change, and cooperate as we know the community does. And I'm anticipating that the response overnight to the call line indicates the community is really responsive, and thank you very much for that.
Is there any issue of the Northern Beaches outbreak was third generation or fourth generation by the time it was picked up? It had gone through a number of transmissions before it was picked up. Obviously, that's a concern because it's already spreading widespread. Given the number of days that you think you might have been infectious, or you may not be able to answer this, but is there an indication of where we are in the generational spread of this? Are we picking up the first ones, or could they be second by this point?
So once we get his, we've always got to be open to, we always keep an open mind, because the worst thing you can have is a closed mind. The obvious hypothesis is that he's transported flight crew that have subsequently become positive, despite being negative perhaps on the inbound. We're still confirming that because we need to cross-check and double-check and make sure that there was no one with a high CT value that wasn't tested. So with all those caveats, if that's the plausible hypothesis, he really hasn't been infectious that long in the community, since the 11th, and we're not dealing with someone else that's infectious. Obviously, we are still putting the pieces of the puzzle together, and that's why that testing on the community helps us. Also, some of the fact that this lady, the lady in her 70s, will probably be repeating testing on her. Again, if she's at the beginning of the infection, that gives us some comfort that she was minimally infectious herself when she was potentially out in the community. So again, we have to put a number of factors together that gives us that level of comfort, and that's why the community's got a key role by, when we're asking you to go and get a test, please do so, because the best data we have will help us make the best decisions.
Have you received any advice that the AstraZeneca vaccine, from the federal or ATAGI, that the AstraZeneca vaccine is the recommended age group is now rising to 60, and if so, is that a blow to the vaccine rollout in New South Wales?
So look, all I'm aware of is that ATAGI throughout this pandemic has been, since the vaccines have become available, has been reviewing and meeting very regularly to consider the latest information internationally, but also the information that we've generated in Australia from our experience and our monitoring systems of the vaccine safety. I know that ATAGI has been meeting over the last couple of days and often provides updated advice on Thursdays. And I have not been briefed on the specifics of that advice, but we generally, as we followed the ATAGI advice.
I understand the investigation is still ongoing, but I haven't been briefed specifically
Is it
anymore.
unusual that we wouldn't have a gentleman spoken to for 5 weeks if they're the subject of an investigation?
It's not unusual. Police will make all sorts of decisions around investigations and suspects, witnesses, persons of interest in that investigation. I don't know the intimate detail of it, so it's really not proper that I should comment.
Can I just ask the saliva testing, is that for people driving people in an airport?
Yeah, so
Are they
basically,
supposed to be tested? What's the process?
yeah, so basically anyone who, every day that someone's at work through our quarantine program or through our border, we have a saliva testing establishment at the airport, as we do a vaccination centre at the airport. Staff are checked in through that program and undertake daily salivary testing, and we do request that anyone with symptoms immediately stops work and isolates and gets a proper, a fully fledged nasopharyngeal swab. And also we do provide guidance that if anyone's on leave for any period of time, that they also attend for testing in that intermediate period.
Have you ever done a saliva test before?
As I indicated, this was the first record we had of him successfully completing a saliva test on that 15th.
So there's a problem there, because if he's been working, obviously, before
So
June
these
11.
are the matters that are being investigated by police in relation to the requirement, but the requirement for participation in the program has been there for a while, and we can provide that detail in
Is
terms
there
of
typically a gap between the
vaccination?
saliva test and the PCR test? Because he was able to continue activities, presumably,
Yes.
between the saliva test.
That's correct. So the saliva test is a background salivary program, and so because we can't have all of our staff, it's a surveillance program, okay? That's why I make the distinction. If you've got symptoms and you work in our quarantine system or work anywhere, you shouldn't be attending work. But if you have no symptoms, we test people on a daily basis. The reason for that is we're hoping to pick up people who have either asymptomatic infection who wouldn't in the usual course to be done, or we're picking up people early in the infection. So the salivary testing is not as sensitive as the PCR, traditional PCR, but clearly testing people is a trade-off between that and acceptability. So we could never do orifocys and pharyngeal swabs on everyone every day because it raises other issues. You know, when we've done that for a few days, we've ended up having people with bleeding noses, and acceptability for staff is very not there. But this testing is being done, validated, and it provides a high degree of assurance, and it's one additional safety. But we've got to look at the fact that we've got a range of hierarchies of control. And the first one is anyone who shouldn't be going to work if you've got symptoms. And if you're in the quarantine system at any time, even if you've had your salivary test that morning, if you develop symptoms, you need to go and attend and get a test. You shouldn't be working when you've got symptoms. This is a program for people without symptoms, and it is a surveillance program, and therefore people can continue to work in the program. As an example, we have a range of what we call, and we didn't use this term in the press release because it's a bit confusing, non-negative salivas. So we set the sensitivity at of the test. It is a PCR test, but it is on saliva. Okay, its sensitivity is less than if you do a traditional nose and throat swab. What we then do is we often get positive. We've had a range of times where we've got what we call non-detects, and then we organise repeat testing. Most of the time, those non-detects will turn out to be just because of the sensitivity of the test. We've set the threshold for this test to actually have the greatest chance of picking up a real case. So the consequence of that is we're often trying of night to do an urgent repeat PCR test. So this is a surveillance program to get that early detection to prevent, to pick up these incursions at the earliest possible time.
Well, thanks all. Last one,
Thank you.
please.
Those aged 50 to 60 who've already had one AstraZeneca jab, is the advice that if they didn't have an adverse reaction the first time, they can safely get another, even if the advice is lifted to 60?
So, as I said, we've I have not seen the updated ATAGI advice. All I'm saying is that I'm aware that ATAGI has been closely looking at this issue. We have always said that the discussion is best had with a GP because for AstraZeneca it is important that the risks and benefits of the vaccine are fully discussed with individuals in relation to the AstraZeneca, and also the precautions people need to take when they've received AstraZeneca. That's been our specific advice. So in terms of any updated advice in relation to 50-60s, I'll await that, but the previous advice was regardless of the age, have the second dose, and certainly the Premier and myself and Minister Hazzard had that, I think, 2 weeks ago. Thank you.
Thanks all.
Thank you. Thanks,
Guys.
everybody.